Hey everybody, this is Alvin J, the most passionate non-doctor on the internet. Today, I'm going to talk to you about epidurals. You know what they are. You're trying to reduce pain. You're trying to get rid of that thing that has been pestering you during your pregnancy, during knee pain, during back pain, just in everyday things in your life. You are trying to get rid of the pain. Now take this. I get it. I know that some people are in extreme pain in their life and they have to have some relief in order to have some semblance of a quality of life. I get that. You military guys who have all these jumps, I get that. You women who are having the babies and you have to go through these difficult, painful, long pregnancies, I get that. That is painful and you don't want to go through it. It's a short-term solution for a long-term problem. Now here's the thing. You might think that you're getting away with it now. All right, getting those cortisone injections into your knees, getting those pain relievers injected directly into the muscle, getting the depot shot, getting the Kenalog shot from Bristol Myers Squibb, getting the the Depomedrol shot from Pfizer. I mean, come on, people. These things are put out by the drug companies simply to make money. If you think your health is at the forefront of their minds, you are bullshitting yourself. They are there to make money. It makes billions. Now, let me tell you this. Epidurals, just epidural injections. That's it. No back surgery, no other kinds of surgery, nothing else included. Just epidural injections. There are 9 million of them, approximately, given every single year in the United States. Not anywhere else. We're not counting everywhere else where they're trying to get in on the racket too. But just in the United States, 9 million shots. It costs $2,000 to get a shot. That's $18 billion. For those of you who do the math, a year. $18 billion. Do you think they're going to give that up for your health? Do you think they're going to tell you all the risks that are involved? When actually, Kenalog and Depomedrol, otherwise known as the depot shot, are not recommended by the drug companies that sell them to be injected in or around or near your spine. In any case, for any circumstance, it is not recommended. Now, this is what we have come to find out. It is okay, and I looked up the literature, it is okay to inject it into a joint or a muscle, that's a whole nother story, the tearing down of your muscle by injecting these poisons right into them, and injecting them into a joint which destroys your cartilage and gives you knee and joint problems for the rest of your life that you then have to go get surgery for anyway. You're just trading one evil for another. So I'm not going to even go that route. Let's just stick with the epidural itself. Okay, you are trying to inject a chemical right outside of the spinal sheath known as the meninges. The top layer is called the dura mater, the bottom layer is called the pia mater, and what's in the middle is called the arachnoid space. Now, if the doctor mistakenly goes too far and he gets the needle past the meninges, or not even past, let's just say past the dura mater, the top layer of the meninges, he can cause awful, excruciating pain. You see, if the epidural medicine, the Kenalog or the Depomedrol, if that gets into the spinal sheath, then it degrades your spine from that point that is damaged down. So you're going to have excruciating pain that you may not want to deal with. Okay, and I'm not, don't take my word for it. Take a look at these few case studies that I found on the Dr. Oz show, and there are hundreds of other ones that are on the internet. So if you don't think this stuff is real and affecting people, you may want to think twice before you do it and look for another alternative, because people just love to go to hospitals and trust doctors. But look at this and tell me, would you want this kind of pain?
Danger? The potent chemical cocktail is supposed to go just outside your spinal cord. But if a doctor accidentally injects it inside instead, this can cause an excruciating, incurable condition called arachnoiditis, documented in these pain diaries.
I can't express how painful it is.
I think that maybe suicide isn't such a bad option.
Another documented risk, paralysis.
A woman from Deerfield Beach has been awarded tens of millions of dollars after being left paralyzed.
A routine procedure called an epidural left her in a condition she never could have imagined.
Worse yet, if a doctor misfires an epidural steroid injection into an artery, that could cause a fatal stroke. Doctors who perform the injections say publicly that catastrophic outcomes are rare. But when researchers surveyed doctors anonymously about upper spine injections, 27% knew of patients who'd had dangerous complications, and 4% knew of patients who had died.
I mean, did you see the pain on these people? Did you see the woman just ouch, ouch, ouch? Did you see suicide is probably better than dealing with and living with the pain. And this is not pain that they had before the epidural. This was pain caused by the epidural. You see, these are medicines that are not supposed to be injected in the spine. They are not FDA approved to be injected near the spine. Into muscle and joint, yes, but near your spine, hell no. But people want the pain gone so bad, they say, you know what, doc, let's go do it anyway. Let me show you what people are actually putting themselves through to get rid of the pain. And if this looks appetizing, if you want to be laid up in a hospital bed and having this kind of stuff done to you, take a look.
On your skin. Very good. And I'm just going a little bit deeper. All the money. Very good. You okay? Yeah. It'll be mostly just pressure from here. If you feel a couple of pinches, it's normal. Just let me know. I can give you some more medication. Good. Okay, we're just going to be moving the machine from to the side to get a different view of your spine, okay? Okay, now this part's going to be mostly just pressure. Stay nice and still for me. Just pressure, right? Good. Almost done, okay? Okay, you're all set. Everything's out. Did great. Okay.
It's just blowing my mind right now. I mean, did you see the needle? He just hollowing out a hole in your back so he could stick a needle, and he's just sticking it deeper and deeper, and he says, is this okay? Is this okay? Is this okay? How the fuck does the patient know if it's okay? You've numbed him to death. He can't feel shit. And now you're going to jam a needle into his spinal column. And then they say, oh yes, it's FDA approved. When on the very same Dr. Oz show, they say, and he has his own team of medical researchers who look this up. They say they have called around. All of the pain management specialists said that the shot or the medicine that we use for the epidural is FDA approved. They said, yes, just lie to your fucking face. And you know what? I have to curse because it pisses me off that people are actually listening to this and thinking that they're getting health care when they're getting nothing but symptom management. See, this is the problem I have with it. This is a very long-term problem, meaning that the pain that you came upon could have been from a car accident, could have been from a surgery, could have been from any number of things that happened in your life. However, it got worse over time. Therefore, logically, it should get better over time. But we in America, we're always about the microwave society. What do? We want to make sure that we get rid of the pain today. You see, it took you 5 years to get that herniated disc in your back, but you just want to go to the doctor and have them fix it right now, and in a couple of days, you want to be up and walking around. See, that's what we get in the habit of. See, instead of taking care of yourself, maybe doing some yoga that would bring the feeling back to your knees, you just kill the knee. Shoot it with these cortisone shots and numb it to death so that you just don't feel it all the time while it's just rotting away your cartilage so that you will never be able to walk again years later. Does that sound tasty? Does that sound appetizing? Does that sound good to any of you out there? Well, I hope not, because we don't tolerate stuff like that, and you shouldn't as well. Now, I have to say, and I'm going to use myself as an example here because I've been through a lot of crap with my body. Now, I was a basketball player, all right? I did high school and I did collegiate. That takes a toll on your knees. Most of my friends who play basketball, every time I see them, it's my knee. I ask them, do you still play? Nope. And why not? My knees, man. My knee got bad knees, man. I can't. Football players I know, bad knees, man. They got bad knees. Everybody I know who played the sport, bad knees, man. They got bad knees. Do you see a pattern here? Now, we got the bad knees, but is anybody doing anything to correct their knee problem the natural way? No, you would just rather get the pain taken away and live a diminished life where you have to keep on going back, and that's the racket to keep you coming back numerous times so that you can keep on paying the money. And the good thing about it is you don't have to come out of pocket. Insurance pays for it, and the drug companies just keep getting rich. Is anybody fucking listening? I mean, do you really consider your health a high priority, or is it more important to you to let the doctor and the health care, or I can't even say that anymore, disease management system take care of you? See, nobody's out there to cure anything for you. They are making money off of you. You're a lead. And I'm going to show you just something that should disturb you. But let me just tell you about it right now. Doctors who give epidurals go to a 2-day training seminar to learn how to inject the needle, to learn where the needle and how deep it should go. That means that it's only theory, meaning that there is no training on how deep to go, when to stop, if there's a transducer that can actually see the end of the needle so that you can, so that we can see exactly where it goes and into the sheath. I would advocate don't do the shit at all, but I know people are in pain. They're going to do it anyway. So pain will drive people, and that emotion, I mean, every piece of logic gets turned off when you are in pain because you just want to make it stop. And I know, I had both of them, bad knees. But what did I do? Instead of going to a doctor, like most of my friends have, and getting the cortisone shots to stop the pain in the knee, I started doing yoga, and I started doing stretch joint exercises to get my knees back. My knees are now in perfect health where I can bend and stand as much as I want. I can still, at 40 years old, dunk a basketball right now today, just came from the gym this morning, and I have no problem with my knees whatsoever. I do squats every day. I do deadlifts every day, and my knees are just fine. If you know what to do to get your joints and limbs back into shape, including your spinal column, then you can do these things. Now, I'm going to tell you something that may blow your mind, but let me show you this first about the doctors, and then I'll take you to that.
That can bring big money. Even more disturbing, some doctors spend just 1 weekend learning the procedure at courses that advertise epidural steroid injections as lucrative options that create dramatic earnings.
It's an excellent course, and of course the business aspect of it, which is the part that I'm paying a lot of attention to.
Which makes you wonder, could epidural steroid injections for back pain hurt more than they help?
All right, so I know, wasn't that wonderful? I mean, these guys are saying, oh yes, we need to bring you in. You're a patient. We need to bring you in for more lead because you're a lead. All right, you're not a fucking box in a goddamn warehouse. You're a human being who needs to be taken care of. So what is going on where you are allowing these doctors to advertise to you, oh, come to our hospital, we'll give you this, this, and this treatment, and they just keep racking it up, and you're just standing there saying, okay. So I can't really do much in the way of trying to remedy that. There's just nothing I can do because I cannot control the American public. I can't tell you what to do. If you got pain and that's the way you want to deal with it, I'm fine with it because it's not my life. But if you want a simpler alternative, a cheaper alternative, one that will last you a lifetime and not take years off of your life, then please, 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 can you please just listen and go to a holistic chiropractor who can stretch you out, do it a natural way, costs a whole lot less money, all right? And you'll have your health on top of that. All right, I'm gonna get on to my last point here, which is getting these epidurals takes time off of your life. It takes months. It can easily take a decade off of your life, especially if you're doing this on a regular basis. I mean, if you just want to get through the pain and you want to shorten your life, that is up to you, but I'm telling you the truth. That's what it's going to do to you, okay? Now, if you ask the doctor about this, they're going to say, no, of course not. We have patients. There's no study that's being done on how long somebody lives from an epidural afterwards and the after effects. That's just bull. But there was a Finnish study. Researchers in Finland, actually did a study, and this is what they found, miraculously. They did a study in which they took a few subjects and they actually did a knee surgery. They called it a meniscectomy. Okay, the surgical removal of the meniscus of the knee, so which is the buffer on the knee. And if you guys don't know, the meniscus can be grown back. So if any doctor tells you it can't, it's bullshit. Okay, the meniscus comes back, right? So they did it, and they took a group of people and they did the knee surgery on them and see how they recovered for a year. They took another group of people and told them they were going to do the same surgery. However, they only massaged the knee, they ran a couple of instruments over the knee, but never cut into the knee at all, never opened it up, never did the surgery. They just told them after they put them to sleep that they did, and they gave them a little incision or a cut on the knee just so they could see, so it would look like they had the surgery. Well, lo and behold, both groups recovered exactly the same. Well, I can't say that it was influenced because it was done in Finland. They're completely independent. They have no interest in telling you bullshit in America, right? Right. So, why are you sitting there believing that a surgery is going to solve all your problems? And in most cases, it gives you more problems, and you'll come out with more problems than it's worth. I'm sorry, but that's the way it is. Now, I would love to elaborate on some other topics here today, but unfortunately, I don't have the time. So what I'll do is I'll come back to you with the next video. This video was put up for a young lady named Lovely Me, who actually asked about epidurals, and I actually became quite curious because a lot of my students actually ask about this topic in class, and they want to know what are some of the dangers of it. Well, when we went to the bodies exhibit, I actually got to see the spinal sheath open and live, just so you can see it in real life, and the spinal strands, and I guess the room for error is so small. I don't see how anybody could risk it. That's it for today, guys. This is Alvin J, the most passionate non-doctor on the internet. Stay well, stay healthy, and stay the fuck out of the hospital. I'll talk to you later. Bye.